Hi there, my name's Alice. I'm a paramedic for West Midlands Ambulance Service, and today I'm going to be showing you how to perform CPR and how to get help. With over 80% of cardiac arrests happening outside of hospital, this is a skill that anybody could perform and could potentially help save a life. With every minute that passes by, the chance of survival reduces by 8%, so in this case, every minute does count. And with 23% of bystanders being less likely to perform CPR on a female, this is the fact that's driven me to raise awareness of CPR. So cardiac arrest is where the heart stops pumping or isn't pumping effectively, and by performing chest compressions, you act as the heart's pump, pushing blood around the body. The first sign of a cardiac arrest is when someone suddenly becomes unresponsive, remains unresponsive, is not breathing or has ineffective breathing with no pulses present. In regards to where to find AEDs, they can be found in shopping centres, leisure centres, schools, but when you call 999, the operator will know where the nearest AED is and will give you a code in accessing them. So firstly, you want to check for any dangers. Is it safe to approach? If it is so, go over to the patient, shout and shake. Hello, hello, can you hear me? Hello? If there's no response at this point, if there's someone with you, ask them to call 999. If not, yourself to call 999. So then we want to check the airway. Is it clear? So have a look, is there any obstructions? If not, we want to perform a manoeuvre called the head tilt chin lift. So by pushing the forehead backwards and lifting the chin up. Now we can look, listen and feel for breathing. Put your ear to the mouth. Can you feel any breath? Feel any chest movement? If this is absent, this is where we're going to start performing chest compressions. Due to the current climate of COVID-19, the Resuscitation Council guidelines advise that you don't have to get close to a patient's airway and you can just visually look for any breathing. You can also place a cloth over the patient's mouth and nose to reduce the risk of infection. So ensure the patient is on a flat surface. If you can get them onto the floor, you want to place your hands in the centre of the chest with one outstretched and the other one interlinked. In the centre of the chest, just where the sternum is. Lean over the patient and lock your arms straight. So we're aiming for a rate of 100 to 120 beats per minute. Depressing the chest a third of the depth of the chest on each compression. So if there's an AED handy or the call assessor has told you where to get one and someone has brought that to you, this is where the AED is placed on the patient. So opening the AED, there's an on-off button. Press that and it'll start talking to you.
Call emergency medical services now. Adult mode.
So take the pads out.
Follow the voice prompt calmly.
And it tells you where to place them on the patient.
Remove all clothing from chest and stomach.
So you put one on the
Rip
upper
clothing
aspect
if
of the
necessary.
patient and to the left
Take out
aspect
the
of the
pad from the
patient.
bottom of the device. Do not touch the patient.
So it's now
Analysing heart rhythm.
analysing the rhythm like it's explaining.
Shock advised. Stand clear.
So you stand
Press
clear,
the flashing orange button now.
pressing the flashing
Deliver
orange
shock
button.
now.
Make sure nothing's touching anyone, no one's touching the
Press the
patient.
flashing orange. Shock delivered.
And then you go back on the chest.
CPR now. Press the flashing blue I button for CPR voice prompt.
So the machine will talk to you and tell you exactly what to do, and when them 2 minutes are up, it will reassess the heart rhythm.
Analysing heart rhythm. Shock advised.
So you do the same again.
Stand clear. Press the flashing orange button now.
Make
Deliver
sure no
shock
one's touching the
now.
patient.
Shock delivered. Begin CPR now.
And then we continue
Press the flashing
CPR.
blue I button for CPR voice prompt.
So you continue CPR until you are physically exhausted, the patient recovers, or a paramedic or medical professional tells you to stop. So to help you keep the tempo of the perfect CPR rate of 100 to 120 beats a minute, Here are some songs that you can think about when performing chest compressions. With the ambulance service attending roughly 68,000 cardiac arrests in a year, only over half of them have resuscitation attempts by a bystander. You and so many others can learn how to perform effective chest compressions. It has been proven that early CPR and early defibrillation by an AED can help save lives. So with the help of Baby Shark and ABBA to keep your rhythm, you can help save lives.